I think the biggest thing is the diversity of the opportunities. When we go into nursing, we know that there's all these different disciplines within medicine and healthcare that we could go into as nurses. And we think that when we go into health tech or informatics, that it narrows that opportunity. But in reality, it really opens up a whole other opportunity platform for us just to really look at everything from, back when I started in informatics, it was really focused on the EHR. But then over the years, it's expanded into anything where there's integrations, anything workflow driven, performance improvement opportunities, just lots. And then inside and outside of the hospital, inside a health system, not just in acute care, but ambulatory and community services. And then outside of the hospital in consulting and health tech companies and just so many opportunities. One of the things that I love about being in health tech is that it expanded my skill set beyond just the nursing process and being able to apply the nursing process to workflows and opportunities for improvement in our work. It added to my skill set in project management and even being able to do some sales within the company. And so just really, really expanding our skill set and the vast opportunities available in health tech.
I love that you're using that value of the nursing critical thinking skills that we learn in assessing the needs of the patient and making a plan and then facilitating communication to help make those plans happen. And that is such a huge part of what we do as nurses. And so I think a lot of people are afraid, like, oh no, the computers are going to take over for us. But there are so many things like that they just can't do. There's so much nuance to nursing. So what advice would you give to a prospective nurse working in health tech?
I get excited when nurses say that they're interested in going into this field because it is a specialized field. You get to maintain your core values and don't ever lose those and don't ever think that it's just about technology. If I go back to nursing school, we had a course in caring in technology and it still exists today. I mean, I've been a nurse for a few years. And so, but that core value still exists. The advice that I would give is get involved. Like be a part of performance improvement in your organization around technology, whether it's on a governance committee or it's in the evaluation of a new technology that's coming in. Let your leaders know that you want to be involved in those things. Honestly, that's how I got into informatics in the first place, was just organically through opportunities to be on committees, be involved in evaluating those solutions, and then having an opinion. Nursing informatics community through organization, just about every nursing organization has a subset of informatics. We obviously have the Nursing Informatics Association, but even within AONL and some of the other nursing organizations, they're looking at how technology is solving for our problems and focus on the problem that you want to solve and then go from there. So circling back to what would my advice be? Just get involved and educate yourself. There's formal education, but there's also just research and opportunities to educate yourself in the area of technology adoption and sustainment is really important.
That is awesome advice. So how much of your job would you say involves the EHR at all?
Actually, I would say less than 10%.
That's incredible.
Ultimately, what we do in virtual care ends up in the EHR, like some of the data, and you're pulling data from but it's really about nursing workflow. It's in virtual care, every organization has different problems that they're trying to solve, although we all know in healthcare, there's fundamental problems that we are all looking at. But really, it's working with the organization to define what those problems are and then marry the technology to the workflow to make sure that it's adopted. And that's really the crux of what we do is change management to ensure the adoption and the investment that the organization is making is valuable. It's not just another tech. We don't want it to be a project. You want it to be something that's sustainable. So the EHR is very, very little of what we do.
Do you feel like you have more or less or the same amount of human interaction in this role?
Oh, as a matter of fact, when I was writing my notes down, that clinical interaction is so important. And that's honestly where I get my drive, is
Mhm.
not in the product itself, but it's in how the product impacts the clinicians that are using it. So I spend a lot of time with nursing leaders, but also with bedside clinicians and
Mhm.
talking through how they're going to use the system and adopt and expand. And, what can we do to support the challenges that they're having?
So it's not like you're just sitting at a screen all day, not getting to talk to people.
No, I'm more sitting at a screen talking to people like you and I are doing, and then just getting out into hospitals. I left the hospital 8 years ago and really have just I get my drive from going into the hospital and being in that environment because that's where our systems are used. Health tech isn't
Yeah.
used at home in an office. It's used in the hospital or, health system. And so I really enjoy getting out and meeting with the clinicians and doing it that way.
Yeah, that human interaction is so important for us and our mental health. So I'm really
And
glad.
helping those who touch patients. It is still about helping those who touch the patient.
I feel like us as nurses, we need the interaction with one another, that solidarity as well. So I'm glad you're getting that too.